Anyway, I would like to take a quote of yours, Senator Whitehouse. You say that in America we have the best doctors, the best nurses, the best procedures, and the best hospitals, and the best equipment in the world. If that's so, then why do you want the government interfering in that? And furthermore, I can tell you that the government hasn't exactly helped look at our postal system. But more importantly to that, I want reform too. You're absolutely right that we need reform. And I mean, this has been for years we've needed some sort of change. But if we want real reform, why don't we go to privatized accounts for a change? I can tell you that in my town of Bristol, the teachers union recently agreed to a contract that included an option of private accounts. And that's happening also in Situate. They also have options for private accounts for their workers. And if we really want to look for change, how about a little tort reform? 84% of trial lawyers give contributions to Democrats, so I can tell you that tort reform isn't exactly in their favor. If we want change, I think we should look to the private sector and try and curtail it before we go into any public option or any more government interference. Thank you.
That was a very fair point, and I appreciate it. Let me, I very much believe that we do have the best doctors, the best nurses, the best hospitals, the best procedures of any place in the world. And people do indeed, some people do travel to other countries to get health care, but many people also come to America to get particularly complicated procedures, quadruple bypasses, organ replacement surgery, things like that. My concern with the healthcare system is that we take all of that talent and all of that excellence, and then we grind it through a system that, at the other end, produces the highest cost per person healthcare in the world. The worst outcomes of any industrialized nation in terms of obesity, life expectancy, child mortality, and other health indicators that leaves 50 million people uninsured, that kills 100,000 people a year because of avoidable medical errors, that bankrupts people more than any other condition that affects American families. So you start with this really wonderful gem, which is the talent of the American medical profession, and then you grind it through the way we pay for it, the way we manage it, the way we fail to support it with infrastructure, and what comes out the other side is uncompetitive internationally, inhumane often to people who are deeply in the jaws of the healthcare system and being chased in every direction by bills and people trying to foreclose on it. And ultimately, I think we can do a lot better. And I think through this healthcare reform process, we can develop a distinctly new American model that combines the best of private industry initiative with government oversight, so that those private initiatives don't get bent into unhealthy areas like the private insurance industry. I don't think anybody, I've never heard anybody defend the private insurance industry being able to tell people, sorry, you're going to get sick, you can't have insurance, or if you got sick, we're getting you off our coverage. That is the kind of place where I think government intervention to control the private market makes sense. Private markets are an exercise in discipline, and the government has to provide the discipline, and so there's a balance there that we're trying to pursue. We may disagree about the role, how big the private role should be versus how big the public role should be, but I think that there's a balance to be struck there, and I think it's important that the private side and the public side need to be represented in that balance. Jack?
No, I think Sheldon made an excellent point. The issue of private accounts does not get at the very central point you made, that's reforming the insurance industry. Because even with the private account, if you are someone who has a serious illness, you can't get help. You could have $1 million in private accounts, they won't let you in because you will cost them more. So there are ways in which we can incentivize competition and private insurance. We've tried to develop that in the context of this exchange. And frankly, the expectation is that the present providers, since they already have contracts with hospitals, etc., will start off from a position of strength and weakness, and the private system will continue continue. In fact, again, we could probably do everything we can to make sure that the current system is not constrained, but actually choices are expanded. You know, if in fact there was full insurance reform, and you then were able to decide how much everyone should get, and they had to take all coverage, then your account system might work. But you know, it's not going to provide health care to people who have a serious illness or something like that. They won't be insured.
Let's go to this gentleman right here, who's waving very energetically.
Thanks for having this forum in the first place.
Thank you for coming out. I appreciate it very, very much.
One of my big concerns, I'm with Rhode Islanders for Immigration Law Enforcement, and I know in Section 246 of the bill, it says no undocumented workers will be granted this insurance. But there are 6 other sections of the bill that are kind of ambiguous where they can still get in and get health insurance. My question would be, if an amendment were presented that required verification of U.S. citizenship or legal immigration status in order to get this health insurance, would you consider that?
I would certainly consider it. I think I have a few hesitations. One is that I think we're working towards a higher level of confidence about one very popular mechanism for this, which is called the E-Verify. And if that in fact gets to a point where the confidence is accuracy is better, I think then we can find agreement on E-Verify. We're not there yet, but it's moving in that direction. I'd also want some obvious exceptions for people who come in, you know, unconscious after a car wreck or something, not to be, you know, already then. But I will reiterate that it is the intention of the Senate to have this program apply only to people who are here with legal status. And if you can suggest language to us to emphasize or confirm that doesn't unduly burden people who are trying to use it legitimately, we would be wide open to that because that is our purpose. And I think Derek and I both feel
I just make a point. The explicit language is that they're not qualified, and we have to develop mechanisms to enforce that right. That's the law.
It appears over in the House of Representatives, Representative Heller suggested an amendment where they required verification of status. And 100% of the Democrats on that committee voted against that verification.
Yeah, as I said, I think we're working towards a higher comfort level with the E-Verify, which picks up a lot of people who are incidentally there. So I think we can get to that point, but we're just not there yet. It is our intention to meet your goals.
6.4%, so I don't know how much better we can get on the qualifications of that.
Another 3.6%, and there are videos of people being scanned. It's pretty important. This lady right